Phyllis, that was fantastic. Thank you. I want to thank first all of our panelists for a truly outstanding closing panel. So thank you very much. I think we need another round of applause here. That was terrific. I learned a lot just listening again. Now, I know all of you want to get to that glass of wine that Phyllis mentioned and those last rays of sunshine, but there are a few thank yous that I really need to go through. The first one actually goes to all of you for coming to Seattle, for sharing your ideas, your insights, your perspectives, for energizing all of the discussions that spilled over into the hallway and across Red Square and over into the tent, and for helping to build this emerging field of ours, global health. So thank you, and particularly you guys who stayed here till the very end, thank you. So now, if I can find the slide thing here. Good, perfect. Now, obviously, none of this would have been possible without our sponsors and collaborating organizations, and I have to tell you that King and I had more than a few sleepless nights until these organizations jumped in to help us. So many thanks to the Gates Foundation, the Doris Duke Charitable Foundation, Fogarty, GHEC, Stanford, UCSF, the various parts of UW who really stepped up to the plate for us, the Washington Global Health Alliance, Washington State University School for Global Animal Health, Weber Shandwick, and the Wellcome Trust. So, thank you. We also had a scientific and program committee that was absolutely superb from all across North America and across disciplines. These 26 people devoted major portions of their lives over the last 12 months to make this conference a success. So thank all of you very, very much. And now within that, I particularly want to thank Hailey DeBoss, whose clear-eyed, Athena-like vision for the consortium really helped guide the development of this conference. Hailey, we couldn't have done this without you, so thank you. Our organizing committee, communications team, the CUGH secretariat, and the UW Global Health staff and our volunteers were actually the people who translated all of the big ideas from the scientific and program committee into reality. And words cannot express how hard they worked on this conference. And I particularly want to thank Chuck Smuckler. Where is Chuck? Can you stand up? And Ann Borns? She here? Okay, where's Ann? You guys just got to stand up. I have to say, over the last few months, I truly don't know when they ate or slept, because they were at this the whole time. I also want to thank Darren Wade here at the University of Washington, our volunteers, especially our bloggers, tweeters, photographers, videographers who made all of our blogging possible. The blog actually is a great way to share what went on at this conference with people who were not able to attend. And I'm told that there were more than 30 posts, including video interviews of speakers and participants. So you really should check that out. It's at www.cugh.wordpress.com. So there we go. And I also want to thank Kate Porter and Carly Copra. Are they here? Well, they and the other Conference Solutions staff were terrific. We couldn't have done it without them. And then finally, I want to thank my co-chair, without whom all of this certainly would not have been possible. King, would you mind coming up here, please? Now, I have known King for almost 30 years, but with this conference, the real King finally emerged, the real King Holmes. However, now that the weight of the world is off his shoulders and this conference is in the bag, I have to pull one more thing out of the bag to thank him on behalf of CUGH for all of your leadership in creating this wonderful conference. Now, it's always risky when you give King a bottle of wine or champagne, but I hope
she really knows
like
me
them.
well.
So, thank you.
Thank you, Judy. And thank you, Judy. You were fabulous.
All right. So by now, I hope that all of you are incredibly energized by this conference, and you can't wait till next year's conference, which will be in Montreal. So I'm going to turn this over to next year's conference chair, who is Tim Brewer, to tell you about next year's meeting. And then you really can get to that glass of wine, I promise.
All right, so first I want to say from my own small vantage point of being involved in this meeting, none of it would have happened without Judy's vision and energy and calm presence. And so, Judy, I think we need to thank you as well. May I have the first slide, please? So this is Montreal. It's where I live, and actually that red arrow is pointing to my office. And so if you get this postcard, you can come visit me. I knew this was going to be an outstanding meeting. I would learn a lot in all the sessions. What I did not appreciate is that the University of Washington is such a stimulating environment that I would be challenged even before I got in the building. And I was walking to Meany Hall Sunday night, and this sign jumped out at me and said, "What doors of opportunity do you want to open? Write your answer here." And I felt bad because I didn't have an answer. And I was alone, and so I didn't know quite what to do. I looked at what other people wrote, and you can see that someone else thought, whoops, I hit the wrong button there. You see someone else thought clean energy, but the University of Washington must have solved that problem because it's been erased. And someone else wrote, no cops, no prison, and I thought, well, gee, that wouldn't really attract me to come to Washington, but as it were, it did get my mind thinking about what I might learn over the next 2 days. I'm an epidemiologist, I think in numbers, and so I collected some numbers that I want to share with you. 8, 65, 20,000, 48,220, 71 million, 884 million, 1.5 billion, and 1.2 times 10 to the minus 5 at Montreal. Now, you probably recognize that Montreal is not a number, but I'm going to see if I can tie it all in for you. So I learned that the Barcelona Center for International Research trained 8 PhDs in Mozambique between 1996 and 2010, that they are all still there, and they are leaders in their national health care system. I learned from Professor Reddy that the Public Foundation of India, the Public Health Foundation of India, has 65 international public health school partners. I learned from Dr. Chavez and Net Tropica that 20,000 people die every year from snake bites in Africa, and that there's a network in Central America of scientists trained in Sweden, now working in Costa Rica, who make anti-venom to treat a problem in Africa. Is that not global health? I learned from Dr. Yamada that during the 2 days that we were here, no, I wrote that number wrong. 48,000, I got an extra zero in there. It should be 48,220 children died primarily of preventable diseases while we were here. I learned that the Fogarty from Dr. Glass has $71 million to spend on programs, but I also learned that the Wellcome Trust has more. So Fogarty is number 2, and they have to try harder. I learned from Muhammad Ali, the junior professor at Emory, not the boxer, that 884 million people worldwide do not have access to safe water. I learned from Mrs. Gates that 1.5 billion Cokes are drunk every day. I have not had any, so some of you must be drinking a lot. And I learned from Haile DeBoss and King Holmes that 1.24 times 10 to the minus 5th % of the entire world's population was here to talk about global health, which brings me to Montreal. So we are really excited that you're coming to Montreal, and it's not because nobody visits us, because it's cold, and we have a population density of 3.4 per square mile, which makes us 1/100th of the Netherlands. We're actually very excited for a couple of different reasons. The first of which is Alan Ronald at a barbecue said, Canada does health equity well. And he's right, we do, and we're very excited to share that with you. But I also recognize that in our First Nation populations, our tuberculosis rates are 9 times what they are in our non-Aboriginal population, and so we still have a lot to learn. We're also very excited because we're bringing together 3 very wonderful dynamic organizations that have slightly different views on global health: the Global Health Education Consortium, CUGH, and the Canadian Society for International Health. Now, I like graham crackers, I like chocolate, and I like marshmallows. But I learned a long time ago that if I take a graham cracker and I put a piece of chocolate on it, and I toast a marshmallow and put it on that, another piece of chocolate, and I put a graham cracker on top and squeeze it, I have a s'more. And if I happen to be sitting by a campfire in the Canadian woods on a crisp, moonlit night, listening to the loons, I have all the ingredients for a transformative experience. And I think we will provide you with a spectacular setting. We will provide you with figurative and maybe literal graham crackers, marshmallows, and chocolate. But for it to be a transformative experience in Montreal, the critical ingredient will be you. And it will be all of our colleagues out there and coming together so that we can continue to share and to learn. And to that end, I want you to write us. I want you to tell us what you want. I want you to tell us what we did wrong. I want you to tell us what we did right so that we can be better and make it and continue to grow on the phenomenal work not only of this organization but our 2 partners as well as we continue to move forward. So in closing, I wish that you take the knowledge that you've gained in the last 2 days, the friendships that you've made and renewed, and you go out and you make the world a healthier and more equitable place over the next year. I wish that you travel safely back to your loved ones, wherever you came from, and I hope that you will join us in Montreal to do it all again in a year. Until then, a bientôt.